We usually think of health as this really personal thing. But what happens when big public health goals seem to crash right into our individual freedom? That's the real tension we're going to unpack today, from huge government policies all the way down to that one-on-one conversation at a doctor's office.
So let's just jump right in. Think about this. Should the government slap a tax on junk food? Is that a helpful push in the right direction, or is it basically an unfair penalty for people who just want a bag of chips?
Okay, or how about this one? Your city decides to rip out car lanes to put in fancy new bike lanes. Sure, it's great for public health, great for the environment, but now your commute is a nightmare. Is that a smart public health decision, or is it the government getting way too involved in how you get around?
And now let's get really personal. You're in the clinic. Should your doctor frame your treatment options in a way that kind of steers you toward the one they think is best? I mean, where is that line between genuinely helpful guidance and, well, manipulation?
See, these problems aren't really about calories or bike lanes at the end of the day. At their very core, they're all about a much bigger debate. What does it actually mean to be free in a society that also really wants to be healthy?
To really get our heads around this, we need a little philosophical toolkit. And the main tool comes from the philosopher Isaiah Berlin, who famously argued that there are actually two totally different ways to think about freedom.
First up, you've got negative freedom. The easiest way to think about this is freedom from. This is the classic idea that you are free as long as nobody, and especially not the government, is getting in your way. The more you're just left alone to do your thing, the more free you are. Simple as that.
But then there's the other side of the coin, positive freedom. This is freedom too. And this idea says, hey, hold on, real freedom isn't just about nobody stopping you. It's about having the actual ability, the real-world opportunity to chase your dreams. I mean, if you can't afford college, are you truly free to become a rocket scientist? This view says, no, real freedom requires support.
And when you put them side by side, the difference is crystal clear. For the negative freedom crowd, the state is a potential threat. Its main job is just to stay out of the way. But for the positive freedom folks, the state can actually be an enabler, a way to create more freedom by providing things like education and healthcare that give people a real shot.
Now here's where it gets really interesting. These two ideas of freedom map perfectly onto how we think about health. Negative health is just like negative freedom. It's just the absence of disease. You're not sick, you're healthy. But positive health, well, that's like positive freedom. It's not just about not being sick. It's about having the ability to truly flourish, to live your best life. And that is what health promotion is all about.
Okay, so with that whole framework in our back pocket, let's look at the actual tools public health officials use when they're trying to balance these competing ideas of health and freedom.
You can kind of picture these tools as a ladder. The higher you climb, the more the government gets involved. So on the bottom rung, you've got simple stuff, like providing information. Climb a step, and you get financial tools, like taxes on sugar. Go up another step, and you find this thing called nudging. And right at the very top, outright bans, like no smoking indoors.
So let's zoom in on that third step, nudging. This has become a super popular strategy. The whole idea is not to ban your choices, but to change the choice architecture. Basically, the environment where you make the choice. So putting fruit right at eye level in a cafeteria doesn't stop you from grabbing the cake, but it gently nudges you toward the apple.
But as you can imagine, nudging has its critics. For one, it's pretty paternalistic, right? Someone somewhere is deciding what's good for you. It can also feel manipulative because it plays on our subconscious biases. And maybe the trickiest part is that it's often hidden. You don't even know your choice is being engineered, which raises some big questions about transparency.
Okay, so now let's shift gears. We're going to step away from the big, wide world of public policy and zoom all the way into the much more personal, intimate setting of the clinic. Because believe it or not, these exact same tensions are playing out between you and your doctor.
For decades, the absolute gold standard in medical ethics has been patient autonomy, your right to make your own decisions. But some critics are now making a pretty bold claim that this whole focus is, well, delusional. They argue that just giving a patient a list of choices completely misses what's really at stake.
So if choice by itself isn't the end goal, then what is? The alternative is a really powerful idea. The real goal isn't just about autonomy, it's about empowerment.
And this idea of empowerment, it's not just a fancy synonym for choice. It's actually the real-world application of positive freedom. It gives us a totally new foundation for how we think about the ethics of health, both for ourselves and for society.
So what exactly is empowerment?
It's all about focusing on your agency, your ability to lead your life from the inside out. It's about being able to cope with the hard stuff that life throws at you, and to weave even really difficult medical experiences into the story of your life in a way that makes sense to you. It's about being in the driver's seat, not just picking from a menu.
And the difference is huge. See, autonomy is all about that one moment of choice. The goal is just let the patient decide. But empowerment is a whole process. The goal is to actually build up the patient's capacity, their agency, their ability to handle things. And this gives doctors and nurses a much clearer, more active role. Their job isn't just to inform you, it's to enable you.
And this is the big aha moment. Empowerment is the ethical bridge that connects everything we've been talking about. The ultimate goal of a good society, to promote positive freedom, to help people flourish, is the exact same goal as good healthcare. To empower a patient to cope, to find meaning, and to live well, even in the face of illness.
So, let's wrap this up. What are the big takeaways here? First, remember there are two ways to look at health, just not being sick or having the positive ability to flourish. Second, any public health plan is this delicate dance between promoting health and respecting freedom. And finally, and this is the big one, empowerment is a much richer, much more meaningful goal than just a narrow focus on choice.
And that leaves us with one last massive question to think about. If empowerment is the real goal for a healthy life, whose job is it to create it? Is it on each of us as individuals to figure it out? Is it our doctor's responsibility to build us up? Or does society as a whole have a duty to create the conditions where every single one of us has the chance to be empowered?